The main issue, though, that people have asked about is, in the trial, what evidence did EPA present to defend their claim that fluoride does not cause neurodevelopmental hazards, loss of IQ, increased risk of ADHD? People have asked, did they actually present any evidence to counter the dozens and actually over 100 studies in humans that fluoride does lower IQ or cause other neurotoxic harms? Amazingly, they did not present a single study that was could not be explained for why it did not find an effect. They did talk about two studies. One was an animal study, one was a human study. The human study was a broadband study. This was done in New Zealand, which has artificial fluoridation, but it was based on kids born in 1972 and then followed. But there's serious problems. It found no effect. It found no reduction in IQ in the children who lived in fluoridated areas compared to those who lived in non-fluoridated. But there's a serious problem with this study, and there have been letters to the editor, and it's been commented on many times, the problems with it. The two basic problems. The first one is there were very few children who lived in non-fluoridated areas in this particular cohort. It had about 1,000 children. Only 100 of them lived in non-fluoridated areas. And those non-fluoridated areas were outside of the city. The main city was Dunedin, New Zealand. And they lived outside in more rural areas. A lot of them were in one particular town, which was outside. And this one particular town, well, so most of these children without water fluoridation took fluoride supplements. And Broadbent, the authors, did not control for that. And other studies in New Zealand at the time found that fluoride supplements could give you more fluoride than you would get from fluoridated water. So in other words, your total fluoride exposure in this study may not have been any different between the fluoridated and the non-fluoridated kids. Another problem with that study is that tea drinking, a lot of tea drinking in New Zealand, especially back then. And there were even studies back then showing how much fluoride the tea drinking would give you. So the mothers who, this tea drinking was never even considered in this study, could have been ingesting much more fluoride from their tea than they would get from fluoridated water. So again, the children who were born in fluoridated areas during their fetal development may have been actually had no more higher exposure than the kids who were in utero during who were living in non-fluoridated. Again, when there's no difference in true exposure, you're not going to find a difference in IQ. I mean, that's just really basic stuff. And that's where this study seriously failed. One other weakness is this area outside the city, the largest town which was not fluoridated, had an unusual water supply. It used groundwater, and it was the most corrosive water in New Zealand, highly corrosive at the time. They have since done special treatment to remove the corrosiveness. So think of Flint, Michigan. When they switched to a more corrosive water, the water itself didn't start out with lead, but it corroded all the plumbing, all the lead solder, everything in it, and gave high lead. Back in 1970s, nobody was testing the water for lead. It was barely even an issue, lead poisoning, and that was mostly from paint chips still. So I found no testing of lead in the water of this town with high corrosive water and no fluoride, but I did find copper being studied because copper pipes and plumbing fixtures were being destroyed by the corrosion. They were leaking. So they were doing studies of copper. They were also doing environmental studies of the copper becoming high in the wastewater and then being discharged to rivers. And it was very corrosive to the copper. So water that will leach copper and corrode copper is very likely to leach lead as well. So it is very possible the children in the main non-fluoridated area may have had high lead exposure. Broadbent never controlled for lead exposure. That might be why if they had not had high lead, perhaps their IQ would have been higher than in the fluoridated areas. So there were many problems with the Broadbent study. That's the only study EPA could point to, only human study that did not find lower IQ in the higher fluoride area, which is amazing because there are 60 human studies of IQ fluoride, not even to mention the 4 or 5 very strong ones that are the recent ones. The animal study, they also focused on a single animal study, even though there's been over 300 animal studies, the vast majority of them finding effects at some level of fluoride. They've found harm, neurotoxic harm. They focused on a single study, the McPherson study, which was in many ways a very high quality study, but there was, I guess I'd call it two fatal flaws in that one. One was the particular strain of rat it chose. It chose a strain of rat that has almost never been used in animal studies. The hooded rat, there's another name for it, I can't remember now, but this particular strain, the only studies that have ever been done with it and fluoride were done many years ago, and both of them found no neurotoxic effects, even at very low levels. So it appears this strain of rat is very resistant. Now, I don't know why they chose this particular strain of rat, but it is a little suspicious because these hundreds of other studies, which have found effects, including at low levels, as low as what this study was doing, almost all used 2 or 3 other strains of rats. And why this McPherson study didn't also use that, because that's actually recommended in EPA guidelines for neurotoxicity studies, animal studies, and NTP guidelines for the way to do it. If there is an established base of evidence from studies that some species or strains of animals are more susceptible, you need to do your studies there. The basic principle is a precautionary principle. You don't look for the least sensitive species or strain. That's not going to really help you, because humans are assumed to be the most sensitive. That's the basic. And if you have to do it in animals, you don't want to do it in the less sensitive ones. So that's the most serious problem with the McPherson study. There were others. It did not use somewhat higher doses, and it found no effects at any doses. So that brings up the question, was something else going on here? Because every other study that's used higher doses has found an effect. So they never even found a dose where there was an effect, which is a fundamental failing of an animal study. You always want to include a range of exposures where at least one of them you can show, yeah, it is having an effect. Just to show that your entire setup of how you test, whether you run them through a maze or whatever, is capable of detecting an effect. And they didn't do that. So that was the one animal study that EPA used to claim safety. It was actually stunning when you look at the total evidence that the EPA had to defend the safety of fluoride.